Hey guys, Dave the Honest Asian here. I want to talk to you guys a little bit about what I carry inside my aid bag. This is a military issued bag. This is an ATS M9. There's a few other bags out there. There's an M9 that's a little bit smaller, a little bit shorter. There's the Black Hawk Stomp bags. There are just tons of different ones people repurpose, salt packs, that kind of stuff. First things first, I'm going to talk about the outside a little bit. I usually carry a tourniquet on the outside that's rubber banded through some of the molle here. It just makes it really easy to grab, pull off, and apply to a casualty if you need to in an emergency situation. On the right side, I carry some trauma shears. They're attached by a North American Rescue lanyard on there. It keeps them near my bag. You'd be surprised on how much you lose stuff in the field. So if you open the bag up, kind of comes into two sections. On the right side, kind of is stuff that I'm going to use when to help fix stuff when I'm going through my assessment, and on the left side is more kind of immediate action stuff that's going to save people right then and there when I open my bag. The first thing I'm really going to go to when I open my bag is this card right here. This is a 9-line card. All you guys in the military should be familiar with it, should know this by heart. It's kind of the military's format of the way of calling in for help over the radio. At the top, I do carry a couple extra tourniquets. I got 3 or 4 cat tourniquets in there, as well as some cravats. They can be used to make hasty tourniquets or slings or whatever. These right here, this is a nasal pharyngeal airway. This is an oral pharyngeal airway. They're used to keep that airway open and help some people breathe if they're unconscious. It keeps their tongue out of the way. These two pen-looking things, these are decompression needles. They're used for tension pneumothoraxes. When you have some proper training, the general populace isn't going to run into tension pneumothoraxes pretty commonly, if at all, but they're made from penetrating chest trauma, where air seeps in and starts putting pressure on your heart. And these can relieve that pressure. Right here is a pulse oximeter. This just gives you kind of a baseline of what your patient is looking like. You just put it right on your finger. It'll tell you your oxygen levels as well as the patient's heart rate. Right behind it, I have a EpiPen. That's not typically carried by every medic in the Army or in the military in general. I use them just because in my unit, when we go to the field during exercises, I do have some soldiers that are allergic to bees, peanuts, that kind of stuff. I like having EpiPens on hand. Right behind there, I've got some thermometers. I've got a rectal thermometer as well as an oral thermometer. If you remember, the only thing that is the difference between a rectal and oral thermometer is the taste, so keep that in mind. Right here, this is just a sharps container, nice and compact. It keeps my dirty needles, needles that I've used to administer medications or do IVs and stuff. It keeps them away from the rest of my gear. It keeps it nice and clean. I don't want to get accidentally stuck by something that's been inside somebody else. Right here are some Halo chest seals. These are meant for penetrating chest trauma. They just kind of plug that hole, keep air from escaping, or keep air from entering into the chest cavity, and which could lead to a tension pneumothorax, which is what's going to happen when you need to use one of these needles over here. On the right side, we're going to talk about some of the airway stuff and some of the bleeding stuff that I have in my bag. This top pouch up here, I carry surgical airway kits. These are meant for, say you've got some massive facial trauma or like an anaphylactic reaction where you're going to need to, you can't breathe and I need to cut into your neck to make a hole, insert a tube so you can breathe. Burns especially, these are very useful for. I do carry a couple extra nasal trumpets, a couple extra decompression needles in the event that I run out or misplace them. Gear gets lost out when shit hits the fan. The next pouch down is my bleeding kit. I've got a bunch of combat gauze. These are super useful. They're infused with a hemostatic agent called kaolin, and they help promote clotting within the blood. These are about $40 online. I suggest that anybody who can and should get these. They're very useful, and they're going to stop those arterial bleeds that are very hard to stop, especially in places that you can't put a tourniquet on. Behind that, I've just got some extra gauze, a couple cravats in there, some Israeli bandages as well, which are essentially ACE wraps that have a sterile pad on there. It helps apply pressure to a specific area, and again can help be used to stop bleeding during an area that doesn't have the ability to use a tourniquet. I do carry some ACE wraps on there to help make pressure bandages or keep the combat gauze in place. The next thing I go over is my med box. I don't carry any controlled substances. There's no morphine, there's no fentanyl, Dilaudid, Versed, nothing like that. I mostly just carry over-the-counter meds. So this right here is some Tylenol, ibuprofen, some Benadryl. I do carry some Zofran for when people are starting to throw up. The only thing I do carry that's a little bit out there is some lidocaine. I use lidocaine when I do sutures on people. Typically, your medic isn't going to be able to perform sutures if you don't have extra training or you're under the direct supervision of like a physician's assistant or a medical doctor. I do carry some intravenous Benadryl as well, and then I've got hemostats, a couple other suture kits, some syringes for administering medications. If you move over, this is a VS17 panel. These are used for marking locations of like an LZ or pickup area where your patient is going to be located. So this is kind of a nice blaze orange color. It's got some infrared reflective tape on there. It's going to be able to be seen by helicopter pilots that are using night vision at night. It can be placed on vehicles, it can be tied down to the ground, etc., etc. Very useful for marking where you're located, where your patient is located. Past that, I've got just my blood pressure cuff here. I buy pretty cheap stuff. Lots of stuff gets misplaced, stolen, or lost in the field, especially when it comes to kind of medical equipment. People like to build their own kits and stuff and steal it from me. I do carry moleskin. Moleskin is very useful, especially when we're doing ruck marches. People out in the field getting blisters. You can use the moleskin for a lot of other stuff too. Right here is a shock blanket. So shock is one of the major leading causes of death. Basically, your body just starts decompensating to the point where it's not conducive with life. This blanket is essentially tinfoil. It's very thin tinfoil, but that reflective coating on the inside helps trap that body heat into the patient, helps surround them and keep them warm, making sure you got good perfusion throughout the body. I do carry an extra EpiPen. Sometimes there aren't, or your single dose isn't enough epinephrine to keep that anaphylaxis at bay until you get to that hospital, especially when you're out in the field. That it could be hours or a couple hours away. You might need an extra dose. If you move down to the bottom, so the bottom is where some of more the advanced care equipment I carry is located. Right down here, I've got a BVM, or an ambu bag, whatever you want to call it. Basically just helps me breathe for a patient that can't breathe on their own. Nobody really does that mouth-to-mouth stuff anymore. It's pretty gross if you've ever had to do that. I don't want any of that near me. Especially with Airway, you're going to need suction. So suction is very, very important. If you are bleeding or vomiting and you're unconscious, you can start to aspirate, which means you're going to inhale some vomit or blood or whatever into your lungs, and that can cause a lot of major problems farther down the line. And you can take care of that very easily with just some suction. I do carry an IV bag, as well as the equipment I need to start an IV. Lots of people carry different things. This happens to be normal saline. There's lactated ringers, there's Hexten, there's a couple new trial products. Some people can even carry blood if that's within your scope of practice. Just a couple needles, start kit, some IV tubing, pretty straightforward. Get some training. They're really nice for hangovers. The next thing I want to talk about is Drip Drop. Drip Drop is essentially like a Gatorade powder, but it's kind of Gatorade powder on steroids. The best way to rehydrate somebody is to rehydrate them orally. You're not. I deal with a lot of heat casualties. You know, right now I'm in the South. It's pretty hot out. People like to not drink enough water, especially soldiers. All they drink is Monster and Red Bull. Drip Drop comes in very handy. The last thing I'll go over here is my intubation kit. As a paramedic, I am able to do an endotracheal intubation, and that's kind of where I pass a tube through your vocal cords and isolate your trachea, so I don't have to worry about any of the blood or vomit or anything in your esophagus that's coming up through your esophagus, from your stomach up to your mouth. It comes with a couple blades and a handle, as well as a light. You just insert the handle, and so you can see the cords passing through. It's super easy, and it's definitely a very advantageous tool to use. That's pretty much about what I carry in my bag. Some people carry stuff that's different. Some people carry it different ways. I found that this works for me. If you guys have any other questions, comments, concerns, feel free to leave me a message. Don't forget to like and subscribe my video. Thank you very much.